Hello everyone and welcome back to our last video all about evaluation and treatment of pelvic health conditions. If you are just now joining us, my name is Kelsey Kavadas and I am a pelvic health occupational therapist. So let's go ahead and get started. Our learning objectives for this presentation are to describe 2 to 3 evaluation techniques and also describe how a typical pelvic health session can be completed. So let's start with eval. What are the goals of an evaluation? So 1, to build rapport, also to get a detailed history and presentation of the client, figure out what the impact is on their ADL and IADL routines, figure out what their current habits, roles, routines are, so what goes on in their day-to-day life. We might do an internal or an external exam of the pelvic floor. Kind of depends on the client and the situation, and of course, if they feel comfortable with it. I usually will also try to get a posture or range of motion assessment just to check out all of that, maybe a breathing assessment if time allows. And also the biggest goal for an eval for me is to figure out what is their goal, what do they want to get out of this. So that is always a question I ask during the evaluation because that's probably where I'm going to start my treatment. So I really want to figure out what they want out of this whole thing. Yeah. So we're going to do kind of a mini case study. So this is loosely based off of one of my old clients. So a little brief snippet about her. So we'll name her Marcia for this. So Marcia is a 70-year-old female. She lives alone. She stopped going outside during COVID and really has limited her outings outside of her home since 2020. So she's really kind of become a hermit, orders everything online, has limited social interaction. So now that things are better and she feels a little bit more confident to get out of her house, she wants to go to her granddaughter's softball games. That is her goal. And she's interested in a date with her neighbor. He has asked her out, so she's thinking about that. She used to work out often, but now feels pressure. So kind of a heaviness sensation when she exercises. She reported her urinary frequency was about 12 plus times a day, but she wasn't 100% sure. She knew she was getting up about 3 times each night. Over the course of the last few years, she developed severe urge urinary incontinence and some stress urinary incontinence during her exercise routines. So she has stopped exercising mostly. She has a history of high anxiety and reports that as a barrier for her. She also has mild constipation. When I asked her about her goal, so her goal was to go to her granddaughter's softball game, she said her biggest barrier and what she wanted to address first was her urinary frequency. So, what could we do for Marcia? Marcia might need a more biomechanical approach, which would include strength training, posture assessment, pressure management, possible internal work, I don't know, maybe. Or she might need more of a biopsychosocial model, which would include an assessment of her roles, routines, habits, her mental health, some behavioral modifications, diet and hydration, that sort of thing. But I would challenge and say she needs both. So Marcia has goals on both ends of the coin. She wants to get back to a very active lifestyle, and we do need to strengthen and assess all of that. But she also has some things that would respond well to those more biopsychosocial things. She has a history of anxiety. She's been very nervous about getting back out into the community, which can contribute to some of the symptoms she's having. She also would benefit from some behavioral modifications of the urge suppression, that sort of thing. So I think for pretty much every patient, we really need to mold these two together and do both. So we need the biomechanical and we need the biopsychosocial. So what does Marcia need? Marcia needs a comprehensive evaluation, including her physical and mental health. Possibly an internal assessment. If I remember correctly, Marcia did not consent to an internal assessment, so we did not do one, and it wasn't a big issue. We can still absolutely 110% get good results without any of that. And so that was very reassuring for her. And the nice thing is, when I tell patients that, usually if they're not comfortable with it, you get a big sigh of relief, and she was one of them. We would go into a big discussion about how her ADLs and IADLs have changed. So here's where you kind of would look at or think about that occupational profile. I don't typically do a full occupational profile on my patients, but I do just kind of take mental notes of what are their barriers, what are their supports, what are their goals, that sort of thing. We have a big discussion about bathroom habits. So what is she currently doing? We want to explore that further. I also would be curious about her sexual functioning. So she mentioned that she's got this date with her neighbor, and it might just be worth bringing up. Maybe it goes nowhere, but at least she knows this is a safe space that she can talk about some of those concerns. And then lastly, what are her goals and her motivation? So she had told me her motivation is to be able to go to her granddaughter's softball game without having to run to the bathroom a bunch of times or without having any leaks. So that's what's meaningful to her, is to get back to spending time with her family. So, where do we start with Marsha? What do we do first? So, depending on what the client's goal is, I will always start with the client's goal, but my intervention on how to get to the client's goal might be a direct intervention, or we might have to do a few things first. So, I always explain that to them. So Marsha's main goal was to tackle that urinary frequency, which is where I would usually start with a lot of my clients. So definitely going to do that first, especially because it's such a quick turnaround usually. So we can it's a good way to get good buy-in and get her really excited about all the other things we can do. So with Marsha, I would start with some education on healthy bladder habits and jump into some of the retraining and those behavioral modifications. So hydration and urge suppression, some breathing to calm those nerves, really just kind of jump into that, figure out how to change those habits. So now it's the next visit, and she's back. She's had great results with the urge suppression, is closer to normal limits on her frequency, still has some stress incontinence, maybe a periodic urge incontinence, but generally it's getting better. So here's where I'd want to tackle that constipation. Depending on time, I may have addressed constipation the same time I address the bladder. Kind of just depends on the patient, but we for sure want to go into some of those bowel interventions we discussed in the last presentation, check out her diet, all of that. And then a big one would be calming the nervous system. So Marsha disclosed that she has a history of anxiety, and she also disclosed that going outside and going on outings now makes her really nervous because of health conditions. So she's concerned about that, and just that heightened nervous system, that already anxious feeling that she has, is going to impact her bladder function, because if she's all tensed up and feeling anxious, and then she gets the urge to pee and she's worried about a leak, she's probably going to have a leak. So we need to figure out some strategies for her. So I would assess what are her current strategies. So usually I'll ask, when you feel anxious or when you feel stressed out, what is your go-to? What do you do? For Marsha, she had said she would exercise a lot, but now she's having leaks with exercise. So it's no longer stress relieving for her. It's actually a cause of anxiety. So exercise was a big one. We need to get her back to doing that without leaks. I do a lot of meditation with my clients, a lot of mindfulness training, a lot of awareness training. Big piece of that is breathing. So checking out what is their breathing pattern. Do they have a very shallow breath pattern? I see that a lot with people who have anxiety. Are they strictly a belly breather? Kind of just check that out. And I will spend several sessions on just breathing. So kind of take a very big deep dive into that. Next, I may bring up sexual function. Ask her, is it a goal for you to discuss some of this? How is that for you after menopause? Has it changed? Something you want to talk about? Any of that? Did you have pain in your last experience? What's your desire like? That sort of thing. Marsha was very open to talking about this because she was excited about the possibility of having a partner again. Her husband had passed away, I think, 10 or so years prior, and she hadn't been with anyone since. So there was a level of anxiety about the possibility of having a new partner. as well. So we were able to go into all of that, discuss healthy lubricants, vaginal moisturizers, things to make the whole thing feel better. And she appreciated that education, and it was fun to go into. Then I would want to take a closer look at her fitness goals. So what was she doing? What does she have leaks with, and what does she want to do? So those are all important questions to ask, because if the exercise isn't meaningful to them and it's not something that they would typically do, they're less likely to do it. So she has a stationary bike at home, and she really, really liked exercising on it. And she noticed that she had a lot of leaks with that. So that was a big one I wanted to tackle. So assessing breathing while on a stationary bike was a big one. So her homework was to go home, try riding her bike, and notice what her breathing pattern is and what her core is doing and all of that, and then reporting it back. And yeah, so assessing those fitness goals, and then starting strengthening appropriately. So we would start introducing those pressure management strategies, start with some gentle core work to bring awareness, and then kind of progress from there. And she was able to get back to riding her bike. She had great results. So she went to her granddaughter's softball games, really had no concerns after that. She was going 5 to 8 times a day. I think she did go on that date with her neighbor and had a great time. And most importantly, she was able to get back to her personal strategies of coping with her high anxiety and things like that. I believe she also started working with a mental health professional, which made that transition even easier. So Martha was a model patient and had great results, which was super exciting. Okay, so how long do we treat a client? Well, I'm going to give you the classic OT school answer and say it depends. Sometimes I might only see a patient a couple times and then things resolve and get better. I see this mostly with my urinary frequency and urgency patients. So if that was their only complaint and their only real concern, then we may fix that in 1 or 2 visits, and then we'll space out and they'll come back in a month just to make sure that we've had lasting progress, and they do, and that's that. Or I might see them for over 12 visits. So my patients with pelvic pain conditions, I tend to hold on to a little bit longer. I may see them for 12, 15 or more visits. It kind of just depends on what's going on and how they're progressing through things. Have we figured out what the root cause is yet? Sometimes it can take several visits to kind of pick all of that apart. So yeah, it just depends. In my clinic, we do once a week visits for about an hour. There are a few exceptions to that. I have a couple patients on my caseload that I see twice a week because of severe pain or something like that. So very personalized, very much depends on what's going on with the client. So at eval, I'll usually put once a week for 12 weeks, and then if we need those visits, great. If we don't, then at least I know I have enough. So kind of just depends on what's going on, but that's the gist. So now that wraps up the eval and treat in a very summarized way. So if you have any questions on any of this, I would love, love, love to hear them. So please send them to my email at thepelvic.ot@gmail.com, or feel free to reach out on social media or even submit a contact form through the website. If I do get enough questions, I might do a 5th video just kind of hashing out in more detail some of these topics and answering those. So please feel free to reach out if you need anything. I really hope that you enjoy these presentations. If you have suggestions for presentations to do in the future, or if you want more detail on any one specific thing, please let me know, and I'd love to do them. So thank you again for joining me for this mini-series. I really appreciate it. Take care.